families with children know how important it is to have an environment that lends to fun, health, everything that we can possibly offer. Sometimes children get sick, and sometimes it's as bad as cancer. What do we do as a family? How can we help? But don't worry about it. We will talk about this a little later in the show. Hi, I'm Jose Antonio Ortiz, and this is Nuestro Valle. We are fortunate to have with us two very special guests. Michelle Zini, who is Executive Director of Pediatric Cancer Foundation of the Lehigh Valley, long name.
Correct.
And Lisa Capas, who is Director of Programming at the same agency. Welcome to Nuestro Valle.
Thank you. Thank you for having us.
Well, it's something we need to do. In this program, we have talked about cancer, all types of cancer, but we never touch children. Pediatric cancer is totally different. We might be talking about cancer, but it affects in different ways. So let's start with, of course, what exactly is Pediatric Cancer Foundation of the Lehigh Valley? Michelle?
We are a local nonprofit organization that has the mission of creating a loving community of support for local children that are diagnosed with pediatric cancer and their families. And we do work very hard to include the entire family in what we do, because when your child has cancer, it really affects everybody. It affects brothers, sisters, mom, dad, grandparents, and we want them all to feel supported by what we do.
Very good, and we will explore a little more during the show. And how did you get involved in the foundation?
Well, my own son is a long-term survivor of pediatric cancer. He was diagnosed with acute lymphoblastic leukemia back in 2001 when he was 3. And he had 2.5 years of treatment, chemotherapy, daily chemotherapy, and many, many medical procedures, spinal taps, bone marrow aspirations, was hospitalized many times. And we were living in Connecticut at the time, and there really was not a support community like this. We didn't have family locally, we didn't have a lot of support, and it was important to me at some point to give back and be involved in this sort of organization. So at the beginning of January, I was lucky enough to be able to accept the position as Executive Director after about 2 years of volunteering. And I'm just happy to be able to give back to other people who are going through the same experience.
Well, I think it's very important to know that it's your own experience, so you know exactly what people go through.
Absolutely.
Lisa, what kind of programs do you offer in this foundation?
Like Michelle said, we really like to emphasize the whole family. Mm-hmm. So we plan evenings out for parents, where we'll send parents out. We pay for everything. Everything we do is free of charge to our families. So we'll send parents out on date night, and while they're out on their date, we'll do things for the children. We've had a lot of fun and really amazing sponsors in our community that have helped us out. So as an example, like Leading Edge Karate has stepped up and done a fun evening for the kids while the parents went out for dinner. We do big events such as Big Top, which is just a big, huge fun day outside at Steel Stacks. That's fun for the whole family. We will incorporate things just for siblings so that they'll get some special time.
Well, that's, I think, as you said before, this is a program that is not available everywhere.
It's not, for sure.
And when you're a cancer patient, it's bad enough, but when it's your child, as a parent, I imagine you don't expect that. You will never be prepared to deal with this.
No, it's true.
And Lisa, how did you get involved in the organization?
Excuse me, I'm a social worker by degree, and I've always worked with children and families in different capacities. And when I heard about this position 2 years ago, I was just blessed to combine all the things that are really important to me, which is just networking, fundraising for a good cause, and just providing support to people that really need it. And our families are so deserving and so appreciative of what we do.
We already touched a little bit, or you did touch a little bit about this disease affects everyone in different levels, of course.
Absolutely.
As a parent, and you are a parent of surviving patient.
Yes.
Were you working at the time?
I had actually been working part-time on a freelance basis. I had actually just given birth to my second child. So when my 3-year-old was diagnosed, I also had a 10-day-old baby. So it was an incredibly traumatic and crazy time in our lives. I mean, we basically lived in and out of a hospital and doctor's office with both a very sick child and a newborn for a very long time. So I was not able to continue working. Thankfully, my husband had a really understanding employer who basically let him stay out of work for approximately 2 months, and supported that and had great health insurance, and we were very lucky, but not every family is that lucky. It has amazed me actually in doing this job, and even while I was volunteering, meeting the families, how many families really do suffer an incredible financial disturbance because of this disease, whether one parent has to give up a job or cut drastically back on hours or travel far for treatment, eat out more often, order food in more often. Almost every family that goes through this does incur financial issues because of it, and some more than others. Depends on your health insurance and what you have to pay. But I was talking to a mom yesterday whose son had to be brought into the hospital by ambulance, and she had to worry about how she was going to pay that ambulance bill, to get her son treatment. So part of what we do is also try to support the families financially. We don't bill pay, but we do try to take some of that financial burden off by offering gift cards to our families. Again, through wonderful supporters and grants and donations, we're able to offer gas gift cards, grocery store gift cards, restaurant gift cards to the hospital cafeteria.
Well, there are so many things. This is a very, very important topic, and we will continue. Friends, don't go away. We'll come back after these brief messages. Stay with us. Thank you for staying with us, and we continue with our chat. We're talking about pediatric cancer and this wonderful organization that pretty much helps families to deal in a better way. They are not alone, and that's very important. With us is Michelle and Lisa, who are the main leaders of this organization. And well, before we went into break, you were saying all the strenuous circumstances for all the families.
Absolutely.
One thing that I think I've read, a disease like this tends to sometimes break up the marriage.
I definitely think there are families that go through an incredible amount of stress, emotional stress, financial stress, and all those pieces together, I do believe, frequently causes rifts within families. And we don't necessarily deal with that part of it, but we do have parents that are single parents dealing with this as well, and it's that's only compounds the problem when there's one of you dealing with this situation.
And in your case, you said you were in a place that didn't offer any support. How do you deal with this? That's a question other people have asked me, and it was definitely more difficult than it would have been without the kind of support that we offer. Again, I think we were helped by the fact that my husband had a great job with great insurance. But, we still suffered some financial consequence. We had to travel an hour each way for my son's treatment. I think some people are just able to kind of pick up the pieces and run with it, and other people need a little more support.
A very dear friend of mine in Connecticut who went through the same experience with her own child has since started an organization there. So she saw a need, as I did, and started one there, which is lovely. So the people there dealing with it are getting support now.
Now, we already talked about the parents. How about the siblings? Do you have any insight on how the siblings deal with big brother or little sister, or they are suffering?
They are suffering, and a lot of times it might not show right away, but later in different ways it might come out. I think some of our kids, are told, have some behavior problems in school. They really have a hard time, and some of them are very protective of their siblings. I'm sure some of them have some underlying, resentment that all the attention is focused on them. So that is why we try to make the siblings always feel very special and included in the things that we do.
Because I've seen that sometimes there is a little resentment. My brother, I know he's sick, or my sister is sick, and they're getting all the attention. What about me?
True. Right. It's true. When we make visits to the hospital, which we do regularly 3 times a month, as well as perhaps to a family's home if they request it, we always try to not just take a little something for the diagnosed child, but also the sibling. We would never show up with a teddy bear for the child who's been diagnosed with cancer and not have one for the sibling as well. So, and you can tell when you're with them that they really, really do appreciate that, to get that little bit of extra.
Yes, so what do you do for the siblings? You include them with the patients?
We do, and what I have found that is really nice is that the siblings of their patient with the cancer, they become friends.
Yes.
And then they can identify with some of the things that they're going through, whether they actually talk about it or just being together and just kind of knowing that the other person is going through that. There's just a very comforting feeling about that. So siblings are becoming friends with other siblings, which is wonderful.
I think then it becomes a network.
Yes.
It does.
Approximately how many families do you take care of?
Well, we always use the number 150. We feel that in our sort of database of families, we have about 150 families. Certainly not all of those are families that participate actively in what we do. We sort of have a core group of maybe about 50 families, I would say, that come to our events on a regular basis, who we provide services to on a regular basis. And unfortunately, there are new diagnoses every day, almost every day anyway, and we're constantly adding to our list, and which is why we continue to fundraise, so we can continue to provide support to more and more people. The rate of diagnosis is really escalating, and that's the unfortunate piece of it.
You just led me to the next part. Fundraising. This costs a lot of money. I mean, you're talking about gift cards and helping with different expenses or transportation, etc. How do you raise funds?
Well, we have donations that come in throughout the year from concerned and generous community members, and we never want to discount that piece because we appreciate it greatly. We have a lot of outside organizations that want to hold fundraisers for us, bake sales and dance-a-thons and ideas they come up with to raise money. We have kids that make these rubber band bracelets and sell them for us, which is wonderful. We do have 3 major fundraisers a year. We hold a gala in November, an art gala, a run in April, and a golf tournament in September.
Okay, the one that I think a lot of people would like to participate is the run.
Yes.
And let's explore a little bit. It's coming up, yes, in April?
It is. It's on April 12th at the Ironton Rail Trail in